Perfect. Hello, everyone. My name is Dr. Jamie Stanhiser. I'm a reproductive endocrinology and infertility specialist at Reproductive Partners Fertility Center, San Diego, here in La Jolla. And I'm with Alyssa today, and I'll let her introduce herself as well.
Hi, my name is Alyssa. I'm a physical therapist at Rehab United here in San Diego, and I specialize in pelvic floor physical therapy. I've been practicing for about 3.5 years now.
Amazing. I'm so glad that we can join forces today. I think this is such a wonderful opportunity. So this is National Infertility Awareness Week. And I know that Alyssa and I both are very passionate about whole person care, really the mind-body connection. And so I think we're both going to talk about that today, coming from different angles. So I'll be coming from the fertility angle as my main specialty, and then Alyssa from the physical therapy viewpoint, focusing on pelvic floor health. And so our plan will be to give two presentations. I'll give mine, and then Alyssa will give hers. And we'd love to take questions. So as we go through things, if you have questions, we will definitely open it up to questions at the end. And we'd love to have this be a conversation together. My main goal, and I bet Alyssa shares it, and I'd love to hear from you, Alyssa, your thoughts on this, but really my main goal for our time together is to empower women. I want you to come home to your body. I want you to seize a hard time like pelvic pain or infertility as an opportunity to come home to yourself. And I want to empower you on that journey. I know Alyssa does as well.
1,000%.
Perfect. Okay, so bear with me. I'm going to attempt to share my screen. And I think it is this. Can you see that, Alyssa? Am I sharing the PowerPoint?
Yeah,
Perfect.
I can see it.
Wonderful. So as you all can see, we're talking today about pelvic health and fertility care, and really with the goal of optimizing your wellness on your fertility journey. I am all about turning challenges into an invitation to come home to yourself. I really do think that, so first of all, challenges are hard. When we have pelvic pain, when we experience delayed fertility, infertility, recurrent pregnancy loss, these are events and experiences of great suffering. And so I don't want to try to diminish that at all. I want to validate how hard that is and the suffering within those experiences. I see it every day with my patients. And I think there is something remarkable about taking radical responsibility for our life experience and for taking a hard suffering challenge and really seizing it as an opportunity to grow and become more of who we are and who we want to be. So I think challenges can bring awareness of where we are and where we want to be. They absolutely actually bring a sense of purpose and drive and meaning to what our dreams are and going after them. And I really do believe that they bring inspiration to us for deeper healing. I want all of my patients and anyone listening to reimagine their fertility journey as a path back home to yourself. I want you to remember your sovereignty and your agency in life. I think bad things happen to us and we can be victimized by life, but I want us to remember that we do not have to be a victim, that we are actually the hero of our own life. And I want the hard time of pelvic pain or infertility to really be something that allows you to reconnect with your body and with your sexuality, and for it to be a journey toward your wholeness. I love the idea that when we listen to our body, we find our way back to trust, softness, and inner strength. So why does the pelvic floor matter in fertility? It is essential to fertility. And I think as women, we can be alienated from our pelvic floor, from even talking about our vulva, our vagina, let me start there. So the vulva is the outside, what we can see, it's the labia, it includes the clitoris. the inside is the vagina. And even using those terms, I know, can make us feel uncomfortable. A big part of what I want to do in the world, and I know Alyssa too, is destigmatize these things. I want us to open conversation and realize the power of our pelvic floor. It truly is the threshold for conception, whether you're getting pregnant through intercourse or with fertility treatment. I think that when we're trying to get pregnant, when we have pelvic pain, when we have infertility, and we're coming to the doctor's office for infertility treatment, it brings up so many feelings of vulnerability, of shame, of anxiety, of fear, of trauma. And I want to validate all of that and also have it be a place where we can bring awareness and growth and healing to that. I really believe that the mind-body connection to wholeness is the foundation of health, integrating our mind and our body together. I also want to use our time together, and I'm sure Alyssa will echo this. I think that experiencing our pelvic floor and connecting with that part of our body is really an invitation to get curious about our ideas of strength. And let me tell you what I mean by that. So we often, I think, in our culture, in our world, are taught that strength is like this, like clenching strong and muscles and everything tight, and you're going to fiercely face this. And I want us to really, as women, but also as mothers, future mothers, women trying to get pregnant, realize that strength is also gentleness, and it's also relaxation, and it's also surrender. It's vulnerability. I think vulnerability can be seen by some as a weakness, but as I go through life, I realize more and more that embracing our vulnerability is actually the greatest strength. And I think this is so true with our pelvic floor, because what I see for many women, because of our feelings of fear or anxiety or trauma, is that when I do a pelvic exam, we clench really tight and we think that that's going to make us safe, that that's going to protect down there, that that's strength. But the truth is, it just makes it hurt more. And when we can work through this together and learn that strength in our pelvic floor can also be relaxation and surrender and feeling safe in that, strong in that, it makes the way smoother. It makes your experience more healed, and that's really what I want for you. I think that the more relaxed and at home we can feel with our pelvic floor, the easier procedures are. So that means for you with fertility care, it will be less uncomfortable. It will be quicker, so more efficient. You won't have to be in that vulnerable position for as long, and it helps with the ease of the procedure for you, and it helps you also get through this treatment when you're coming regularly and have to face this in a daily way. And finally, very importantly, your pelvic floor matters with fertility because it is this awakening to reconnect, reclaim your sexuality, your feminine power, and your wellness overall. So, what is the pelvic floor? It is first and foremost a powerful, supportive net that is also flexible and responsive to your needs. So the pelvic floor is a group of muscles, ligaments, and connective tissue, as you see here on this graph, that support, first of all, your clitoris, your vagina, your bladder, your uterus. It also supports your anus, your rectum. It is involved with urinary function, with fertility, reproductive health, and with GI health as well. And it really is this supportive net that can also impact, by the way, core strength, posture. And it's an important part of your body that I want you to become. All of our body is beautiful and sacred, and I teach my kids that their pelvis is beautiful and sacred too. So we can go through all of these different muscles, but we don't need to today. The point is that it's a supportive net. It's there to help you throughout life, and I want us to be conscious of it and really embrace its strength and what it does for us every day. So what are specific pelvic floor challenges that impact the fertility journey? You see them listed here. Really, our pelvic floor impacts us through so much of our life, not just in our reproductive years as young women and women that are in their 30s and 40s, but also postmenopausally. So throughout our life, we're impacted by our pelvic floor. And intentionally nurturing its health is so important. So one of the main ways I see issues with pelvic floor or challenges with pelvic floor become apparent is that women have vulvodynia. So vulvodynia means that with touch of the vulva, which again is the outside structure of female reproductive anatomy, the labia, also the opening to the vagina, that with touch, that is really painful. So if later on in the slide I have listed on the third one is dyspareunia. Dyspareunia is pain with intercourse. But when women come to me saying that they have pain with intercourse, it's important to figure out, is that pain with insertion, which would make me think more about vulvodynia, pain of the outside, versus is that pain with deeper penetration? And that makes me think of other things that we'll go through here. Next on the list is vaginismus. So vaginismus is when our pelvic floor muscles are very tight. And any sort of penetration, whether it's with, there's varying degrees of this, but I see it quite severe, where even, a digit, a finger is incredibly painful for women with vaginismus because their pelvic floor is so tight. This makes speculum exams painful. It makes intercourse painful. We are at risk of both vulvodynia and vaginismus and dyspareunia and pelvic pain when we have history of trauma, when we have different conditions that I'll go through. But I think it's so important, and I'll talk about this more, that we become aware of this, that we become aware that it doesn't have to be this way, that we can work through this, and finding a provider who makes you feel safe. And then working with a team like Alyssa with physical therapy to help you heal. So when a woman comes with pelvic pain, and specifically pain with intercourse, I'm thinking more about endometriosis, which is an inflammatory condition when the lining of our uterus implants outside of our uterus and our pelvis and causes essentially bleeding in our pelvis when we have our periods. And that local inflammation and scar tissue that develops can cause both pelvic pain and infertility. So I'm always thinking of that. Ovarian cysts can cause pelvic pain, and also fibroids can cause a mass effect because fibroids are benign overgrowth of the muscle layer of our uterus. As they grow bigger, they can be causing pelvic pain, pain with intercourse, so we're thinking of that too. The pelvic floor is so important. I think your relationship to your pelvic floor, when it comes to your delivery experience, all of fertility is such a vulnerable journey, trying to get pregnant, the hopes and fears during pregnancy, being so vulnerable during either a vaginal delivery or a C-section, and having a good connection to your pelvic floor is so important to feel empowered in that experience no matter what happens. After delivery, with how we heal, our postpartum healing. So we can have vaginal laceration tears of part of our pelvic floor, which we call our perineum, which is the area, the tissue in your vagina and your anus. And pelvic floor health really impacts how well you heal there. Prolapse happens, we're more at risk of that the older we get. So after vaginal deliveries, pregnancies, in our postmenopausal years. And prolapse is when our pelvic floor muscles may be weak, and so the cervix or the uterus can actually kind of prolapse downward and even protrude past the vulva. And so that is associated with incontinence and discomfort and feelings of shame. And so all of these things can be helped and mitigated by strengthening. So what are specific signs that you might benefit from pelvic floor healing and support? I think you can guess many of these already from what we've talked about. So pelvic pain, absolutely. Pain during intercourse, pain with internal procedures. Pap smears should not hurt. They should not hurt. I want you to tell your provider if they hurt. Difficulty relaxing your pelvis. So if you feel tense there, if you feel you're carrying a lot of stress, if you're feeling disconnected from your pelvis, and especially feelings of fear, shame, anxiety, and trauma associated with your pelvis. These are all signs that I want us to come home to our bodies and assess how we feel about our pelvis and our pelvic floor, and think to yourself if you might benefit from getting some help and support with this. So why does pelvic health matter, specifically when you're trying to conceive? For those of us who have tried to get pregnant before, I think we can all absolutely say it's a stressful experience. Even if it's your first month trying to get pregnant, you want this so much. It feels like everything's on the line. And intercourse really changes from being something that was purely for emotional connection or physical pleasure into something that's very goal-driven. And it's really often our biggest goal and dream to have a baby. And so there's a lot of stress associated with it. It's hard on the individual woman. It's hard on the couple. And so when we can attune to our pelvic floor and work on our connection to our pelvic floor, it really helps to make intercourse more comfortable and pleasurable when you're trying to get pregnant. I am a big believer that whole person wellness, so improving our relationship with our pelvic floor, is going to actually improve our whole life. It's going to improve all of our health. It's going to bolster our resilience and our ability to keep going in our attempts to get pregnant, on the fertility and infertility journey, and in daily life. And I think it is, again, a challenge that is also a huge opportunity to connect with yourself and connect with your partner in this journey. Why does pelvic health matter during fertility treatment? We've touched on this already, but I want to make sure that it's clear that a relaxed pelvic floor really makes internal procedures easier and smoother for you. It helps to reduce discomfort, and it also releases tension and the anxiety and trauma of having to come into the doctor's office for something that you already have a lot of big feelings about on the fertility journey. What can you do? The first thing is that I want you to notice. So for all of us, I'd love it if I pause and we just take a deep breath together, blow our air out. How do you feel in your body? How do you feel in your pelvis? I want this mindfulness practice to be a part of our daily life. I want us to connect with ourselves, and I want you to journal what you notice, and you can track it across the days or the weeks. I think the first step is an awareness of where you are, and then asking yourself, where do you want to be? If you do notice that you're experiencing any of those symptoms I was talking about, pelvic pain, pain with intercourse, feelings of shame or alienation from your pelvic region, I would love it if you would talk to your OBGYN about that as a good first step. Your OBGYN can give you resources. They may refer you to, these are all, by the way, types of OBGYNs. So urogynecology specialists are OBGYNs that specialize in prolapse, in incontinence and things like this, versus reproductive endocrinology and fertility specialists like myself. We specialize with the fertility side of things. So your OBGYN may determine which route would be better for you, or perhaps just the general route, staying with them. I am a big proponent of multidisciplinary care, so getting your care team. This is super important. We're a whole person. I don't want you to just get a medical doctor. I think they're essential, but what's also essential is getting people like Alyssa. So seeing a pelvic floor physical therapist is huge. I also think, because this is whole person wellness, that seeing a mental health therapist that specializes, that understands and gets pelvic pain and pain with intercourse and infertility and recurrent pregnancy loss is huge, because so much of this is coming home to our bodies and reconnecting our mind to our pelvic floor, and feeling safe there. And I think a mental health therapist can really help with that. Um, I want you to practice breathing and mobility exercises, and I'm going to go through that a little bit more, but I know that Liz is going to hit on that a lot, probably the mobility exercises. Um, and also what you can do is what each of us can do in our relationships with our friends, with our partners, with our family members, is begin to have brave, courageous, open conversations about pain and intimacy and fear and tension and shame. I think that's so huge for all of our healing as a community. I really, really want you all to know that fertility is whole body work. And again, I encourage collaborative care. My main message to you that I hope I inspire you with is that you are the hero of your own life. I want you to reclaim your story. I want you to know that really this can be a clarion call, the suffering that you've had, to take charge of your healing and your life experience. I think it is so powerful for us as women to ask ourselves, maybe for the first time, what do I want? How do I want to feel? What do I want my journey and to mean and to be? I think society tells us a lot of things about how disconnected we should be from our pelvic floor. I would encourage you all to get a mirror and look down there in your bathroom on your own and know that you are beautiful there. You are beautiful everywhere. It is a sacred area. And I'd love for you to connect with your feminine power and be empowered on your life journey with this. The other big thing is I want you to trust yourself, trust your body. It is recommended that if you do not feel safe with a provider, so whether that's an OBGYN or a physical therapist or a mental health therapist, if someone is not making you feel safe, if someone is not getting consent, if someone is hurting you, I want to empower you to tell them to stop. I want to encourage you to find a different provider where you feel held and safe, and there's that trust between you as the patient and then the provider. It is so important. There's an art in medicine. I know that Alyssa will echo this as well. There's an art. There are different artists. There is no reason why your pelvic exam should be painful. Absolutely none. It's super important to me with my patients that for whom I can tell that they have trauma or pain or fear with pelvic exams, that first we just take a moment and we focus on our breath. And we just focus on our breath. And then it's light touch. And then it's a very gentle exam. And it's checking with them, are you okay? Do you want me to continue? Do you want me to stop? There are providers like that out there, and you deserve that care. And trust yourself. So these are my top 6 pelvic floor relaxation techniques for fertility. I would love for us to develop a meditation practice. This can look different ways. There's apps for this, like 10% Happier. There's actually wonderful ones on YouTube, so meaning that they're free. But really, most of this comes down to centering on your breath. Feeling slow, deep breath in, slow, deep breath out. It can be visual meditations, so I love to have my patients during pelvic exams envision a forest with the light coming through the trees and a river and the sound of the water going over the stones in the river. And the feeling of the sun on their face. So things like that make you feel calm and safe, that can reconnect you to something that may have been traumatic or painful or shameful for you in the past, and it allows you to see the beauty in it and the safety in it. I also love a type of meditation that's called progressive relaxation. So you're going to laugh at me. I'm going to scrunch up my face. But so progressive relaxation meditation is when we intentionally tighten an area of our body. So we feel what it feels like to be tight, and then we relax it. And we do this from our head, our neck, our chest, our arms, our hands, our abdomen, sequentially tightening it up and letting all of that tension go. And we do that in our pelvis as well. So intentionally tightening it up, feeling what that feels like, and then relaxing and letting that go and feeling what that feels like is a tool for reconnection. I also love child's pose. So you'll probably know child's pose, but it's when you kind of lay with your hips kind of splayed apart, and then you put your arms forward down on the floor like this, and then you do big diaphragmatic breaths like that into your pelvis. So deep breath in, deep breath out. And that allows stretching and mobility, and then also the meditation practice with it. My overall favorite, though, besides a breath-centered practice, is what I call my heart, body, hand mantra. So what I'd love for all of us to do, and I can't see you on the camera, but I'd love for all of us to put a hand on our heart and a hand on our abdomen. And just take a few deep breaths in and all the way out. I love my body, and my body loves me. I trust my body. Body trusts me. I am home. I am safe. I am good. I am sovereign here. I love that meditation. And you can do that at any time. Whenever you're feeling some anxiety or big feelings, a hand on your heart, a hand on your abdomen, feel your breaths and choose whichever of these feels home to you. And then I also love journaling prompts. So journaling prompts may be things like, what is my pelvis trying to tell me? How do I feel? What is my connection to my pelvis? Do I feel safe? Do I feel fear? Do I feel shame? Again, just starting with that awareness. How do I want to feel with my pelvis? What do I want my sexual energy to feel like? What do I want intercourse to be like for me? What do I want my fertility, my infertility, my pregnancy loss journey to mean for me? Who do I want to become in this? What strength can I find here? I think these are all awesome for our daily practice. So resources and next steps, and then I'll give the floor over. I love to read. It is one of my very favorite things to do. I read every night before bed. These are wonderful books. I'm wanting to add to this list. I think The Body Keeps the Score by Bessel van der Kolk is wonderful. About that mind-body connection. I love Radical Compassion by Tara Brach. It's a beautiful meditative practice that helps us, again, it's whole person care, so it helps us with our connection to our pelvic floor, but it helps us in every area of our life. It's through the practice of RAIN, which is essentially similar to recognizing your feelings, accepting them, giving kind of inquisitive care. So asking questions about where is this coming from, and then nurturing that feeling and that experience. And I think it improves our whole life, including this. I also love the book Come As You Are by Emily Nagoski. And I love what she says. She says, you are already sexually whole by just being yourself. I also really love a new book I found recently, is Sacred Sex Ed by Leola. And it's a totally different angle about sex ed that I think we all should have had from the beginning, about connection, about it being about a way to connect with yourself, with a partner, to come home to yourself, and to really reclaim and reimagine your feminine energy. And then just because I have such a heart for patients trying to get pregnant and on the parenting journey, I love the book Parenting from the Inside Out. I think every person who ever wants to be a parent should read it. It helps with pelvic floor health too, because really what it is about understanding our story and accepting it, and then writing our story for the future. And I think our parenting journey begins way sooner than when we have our baby. Our parenting journey begins in the work that each of us are doing right now, to come home to ourselves and to heal ourselves. And so this book is about reparenting yourself and reconnecting with yourself, so that you can be the best parent connected with your child in the future. I also really believe in a referral network. So my practice has a list of mental health therapists that are specialized in pelvic floor health and in fertility and recurrent pregnancy loss. And also acupuncture, by the way, is just another adjunctive care. And then finally, Alyssa, physical therapy. So thank you all so much for your attention and time today. It's been an honor, and I will let my wonderful colleague take over.
Perfect. Okay. Thank you so much, Jamie. That was awesome. And I completely agree. I love working with women. I love empowering women. It's super fun to work with women every day and get them aware of their bodies and yeah, just bring up things that maybe they haven't thought about, and educating them about their own bodies is amazing. So I don't have a PowerPoint, but I have props. Okay, so backtrack, there's going to be a lot of overlap between what she said, but kind of backtracking a little bit to go over what pelvic health is. So you think of, a lot of people have been exposed to regular physical therapy, right? Maybe you hurt your shoulder, you go to physical therapy, they check out your range of motion, they check out the strength, kind of poke the muscles, look at your posture and things like that. And then we can make a plan of how to address whatever symptoms you're having. So pelvic health is exactly the same. It's just kind of focusing on like a huge area. So we look at everything that attaches to the pelvis. So looking at the back, looking at the abdominals, looking at the pelvic floor muscles, and then also looking at the hips. The SI, or this joint, or is this joint back here. We also look at that. But we just want to make sure that whole area is healthy, because there's so many things happening inside of here, the reproductive organs, the bowels, the bladder. As long as we're kind of taking care of all of these areas, that internally this should be helped as well. So going back to pelvic health and kind of what Jamie was mentioning, we want the area to not only have strength, but also length. So each area needs to have, a certain range of motion, a certain strength for you to go about your day. So we, as pelvic floor physical therapists, look at all of those areas and kind of look at a whole picture of you and can help make it so each area is pulling their weight. So yeah, as far as pelvic floor physical therapy, what you could expect if you were coming in and you were one of my patients, like I was saying, I would assess full picture, full body, see what's going on externally. And then if you're comfortable with it, we definitely do want to be taking a look internally at the pelvic floor muscles. As Jamie said, everything is always with consent. So sometimes patients aren't prepared for an internal exam at physical therapy, or they just weren't expecting that was a part of it. Totally fine. It's nothing that you are like forced into, but it gives a ton of information. And if you are if you are going through fertility treatments and trying to get pregnant, it's definitely something that would help you in the long run if you're comfortable with it. So basically what a full pelvic floor assessment would be is exactly what I talked about for the shoulder, but for the pelvic floor. So basically, obviously you'd be in a private room, and we're assessing the external muscles, seeing if there's any pain, any tension, any sensitivity, and so on. So we kind of start externally, and then if you're comfortable, we can do an internal assessment. And that's literally where we're inserting our finger and assessing the muscles. We want the muscles to be able to lengthen and stretch. So going back to what Jamie was saying, traditional ways of conceiving is through sex. So if you're having pain with sex, pain with penetration, and it's that initial penetration, there might be some pelvic floor tension. And we treat that at physical therapy. So you think of other muscles that are tense in the body and we kind of massage them, we stretch them. Same exact thing here. Once again, they're just muscles. Once you kind of get that understanding that the area here is muscles, the muscles can be weak, they can be strong, they can be tender, there can be knots in them. So we're just treating them as such. If there's a lot of tension in the muscles, we're just holding pressure on that area, guiding you through breathing. There's a huge connection with breath and the pelvic floor, and we can kind of get the muscle to release. If we find you also have a ton of hip tension and maybe a lot of back tension, then we're also going to be treating the back and the hips, doing stretches for those areas, and it can transfer over to the pelvic floor. But sometimes people are kind of like, okay, I have pain with sex, but how, like, what are you going to do about that? So once again, there's different reasons why you might be having pain with sex, but likely it's because of some type of muscular issue, whether, once again, it's tension or laxity causing organs to kind of start to push down. Maybe your partner's hitting those areas and that can't be comfortable. Or there could be a trigger point or like a knot in the muscle, similar to a knot in your neck. And if your partner's hitting that over and over, that can't be comfortable. So by doing a direct pelvic floor assessment, we can kind of see what's going on, see if it's more tension related, see if it's more one-sided than the other. That's really common as well. You know, we have a dominant side, and it's really common to have one side that's really tense, and then we check the other side and the patient's like, oh my gosh, I had no idea. And maybe you have an injury, you know, to your right hip, and now that's caused tension on the right side. There's so many different things that can cause dysfunction at the pelvic floor. And that's why we look directly at the pelvic floor, but then we're also looking outside as well. I always kind of tell my patients the body is like a giant group project. You go back to high school and your group projects. Each area has the range of motion it needs, the strength it needs to do everyday things like walking. You know, we need like full extension of our knee to walk properly. If your knee is a little stiff, you're not just going to not walk. You're still going to walk, but there's an area of your body that's now taking on more work than it's supposed to be. And it's okay at the beginning, but then over time, you know, that increase of work is kind of building its way up. And then eventually that area is going to hurt and it's going to be like, I don't want to do this extra work anymore. And so like that can affect it. If you're having ankle or knee or hip issues, it can travel its way up to the back and up to the pelvic floor. So we look externally to be also treat kind of like what we call like indirectly, and that can decrease the stress that's going to the pelvic floor. Going back to directly talking about kind of fertility, people that are going through fertility and how pelvic floor can help them. We talked about pain with sex, but even if you're not taking the quote unquote like traditional route, and you're doing something like IVF, you know, there's still vaginal ultrasounds and things that are needing to be inserted vaginally. And so it would still be helpful to have the proper length of the muscles to be able to have those treatments. And depending on what stage you're at in the IVF process, you know, you might be going in multiple times a week getting these ultrasounds. And if they're super painful every single time, your body is gonna not be looking forward to those appointments. And also like just naturally kind of being, maybe re-injured is not the right word, but kind of they're re-stressed each time. And once your body has kind of associated something with pain, it does take some time to be able to work past that and retrain the brain of, okay, we're able to lengthen the muscles, there's penetration, it's not painful, and kind of retraining the whole body to realize like, okay, we're able to do this, we're helping the muscles, and we're getting better, versus if you're just going in over and over, it's painful, or having sex over and over again and clenching every time. The body kind of remembers that. And so part of physical therapy is also, you know, like actually doing muscular changes, but also retraining the body to realize like, okay, there's something inserted, it's not painful, we're able to, like, we're in a safe place, this is consensual, like all of those things, kind of reminding yourself, okay, this is easy, like I'm getting better. And then actually going back to that, I didn't really specify, it's not supposed to be a painful experience. And so even when we're trying to lengthen the muscles, or the muscles might be kind of tender and sensitive, it's not supposed to be anything that's like forced. It's not like putting a speculum in or anything like that. Like there's open communication constantly between the physical therapist and the patient, and what they're feeling, and making sure there's not too much pressure. It's a manageable pressure and not anything that's like increasing pain. So just want to make sure I say that. As far as anybody that's going through fertility treatments, whether you're having any type of what we call pelvic dysfunction or not, I highly recommend you still come to see a pelvic floor physical therapist. The whole goal of fertility is to get pregnant, and I definitely recommend 100% of pregnant people try to see a physical therapist as well. Once again, even if you're not having any pain or any issues at all, it's good to kind of get looked at. Just because we're not having any symptoms doesn't mean we don't have anything that we can work on. So we can assess the hips, assess the back, and be like, oh, this left hip is pretty tight. I'm glad you don't have pain, but let's kind of get after that before it causes pain. We can also educate on proper like lifting and breathing, and all of those types of things to minimize your risk of getting, back pain during pregnancy is super common, pelvic pain, urinary leakage, constipation. Those all can be treated with pelvic floor physical therapy, and once again are really common things, but not something that like you have to live with just because you're pregnant. And it also, if you kind of think about if you have a planned surgery, going back to the shoulder, I guess, if you have, you're going to get a shoulder replacement, usually you're sent to physical therapy beforehand. The stronger you go into the surgery, the stronger you are out. Same exact thing for fertility and pregnancy. The stronger you go into your pregnancy, the stronger you're going to come out. There's great research showing moderate physical activity 5 days a week for pregnant women heavily increases like the strength of the mom and the baby during labor and delivery. So if you are thinking physical activity, physical therapists can progress you and give you very specific to your needs exercises and stretches. Make sure you're progressing at a safe rate, and then that's also helping to increase the strength of your baby that during delivery and postpartum. We help with decreasing birth risks. So, like what Jamie mentioned, prolapse, perineal tearing, diastasis, low back pain. If you're able to manage that during fertility treatments, then you're less likely to have it during pregnancy. If you're able to not have that during pregnancy, you're less likely to have it postpartum. So it's all they all bleed into each other. So I highly recommend, if you're on the fence, just trying to go see a physical therapist or a pelvic floor therapist, and then you can make a plan. And if you're not having anything and you're on the fence, just maybe once a month coming in and just getting a checkup and having good homework to give. And there's so much education to give. I feel like I could talk forever about like what Jamie was already going through, stress management. Hormones are a huge thing when you're trying to get pregnant. Stress just doesn't ever help anything. But we can try to manage hormones through stress and sleep and exercise and nutrition. And people like Jamie, people like us, we can all give you that education to manage the hormones as best we can and give you the like healthiest version of yourself to prepare for becoming pregnant. I love what she said about multidisciplinary. Getting a mental health therapist is so great. Yeah, like definitely 1,000% need that. And just making sure you're checking off all of the different boxes that we can and getting as much help as you possibly can to make it as successful as possible. I feel like I was talking a mile a minute. Sorry.
No, I loved it. That was also wonderful. I would love to open up the floor to questions, and I think we already have a question that I think actually Alyssa may be best suited for. In the Q&A, it says, I have to get 2 fibroids removed. They are still working on scheduling. Would starting pelvic floor physical therapy before the surgeries be helpful?
Yeah, great question. And yes, so we treat people that have fibroids or PCOS or endometriosis, all things that Jamie mentioned. And I mean, so we can't get rid of those things, but we can manage what is happening because of them. So commonly with fibroids, the body doesn't like them. So the area will kind of start to create tension of the muscles. It can cause a lot of pelvic tension or abdominal tension. And so we can manage that. And that can really help reduce the symptoms that you get, usually really painful. If you're still having a regular cycle, that could be really painful periods. And we can help manage symptoms during that. Also, I just lost my train of thought. If you are getting them removed, even going back again, you're going to have maybe a hysterectomy, or if you're just having them removed by themselves, it's the same idea. Like the stronger you go in during that, the stronger you're going to come out. If you can learn abdominal bracing techniques, ways of decreasing stress to your abdominals, and you're getting something like a hysterectomy, it's going to be huge to learn, ways to get in and out of bed, breathing techniques so that you're not increasing stress to the area, even like scar treatments. We teach all of those things to help you prepare for the surgery that you're having, and also hopefully like manage pain up until you can get those removed.
Awesome. Thank you so much.
Yeah.
The next question is, at what point should someone seek help? And I'll give my answer, and then Alyssa, you're welcome to give yours. I'm going to amplify it. So in my opinion, when should someone seek help? So when it comes to pelvic pain, I think that if you have pain with intercourse, any pain with intercourse that's consistent, so meaning if it's just one time and it was a very unusual incident, but otherwise it's great, you don't need to seek help. But if it is more common than not that you have pain with intercourse, you should absolutely seek an evaluation from your OBGYN and consider physical therapy for your pelvic floor. If you are on the fertility journey, if you are younger than 35 and you've been trying to get pregnant for 12 months, you should absolutely see a reproductive endocrinology and infertility specialist like myself. And we will certainly assess about if you have pelvic pain at that time and refer you to PT. If you are older than 35, I'd want you to try to conceive on your own for 6 months, and if not pregnant, see an REI like me and get help. If you have pelvic pain, if you have just general pelvic pain, I want you to see an OBGYN and consider PT because you may have something like endometriosis if the pain is associated with your periods. Periods can have mild cramping, but severe cramping is not normal, and it's usually endometriosis, and I want you to get evaluated. Other reasons to get evaluated would be if you're having irregular menstrual cycles when your periods are greater than 35 days apart. I'd want you to see an OBGYN about that. I think also, like, when should you seek help? I think all of us should seek help right now. It doesn't have to necessarily be with a specialist. It can be reading. It can be enriching ourselves with a meditation practice. It can be seeing a therapist. But I think all of us have a better life experience by reconnecting and coming home to our bodies. And so I encourage all of us to do that every day. Anything you want to add, Alyssa?
Yeah, I love all of what you're talking about as far as like periods. I think that is something that is not really, we're not really educated as well as we should be. Growing up, at least I know like my sex ed class, we did not really learn about what is normal and what is not. And I think women are always a little bit gaslit during things like whether they're, on their period or they're, pregnant or they're going through menopause. It's always like, oh, it's the hormones, it's totally normal, like that's to be expected. But knowing the norms for periods is so really important to know. So exactly what she touched up on, questions that I directly ask to kind of gauge people, just because a lot of times people think it's normal. I'll be like, oh, how are your periods? And they're like, oh, the usual, like normal. And then I'll dive in and say, okay, how many days do you bleed? And so if that's more than like, for sure more than 10, that's concerning. But really I would say like more than 8, is a little bit abnormal. If the bleeding is heavy enough that you're changing a super tampon or a large pad, or even like the period panties, if you're changing them hourly, or still leaking through and you're wearing a tampon and a pad, you're worried about ruining clothes all the time, that's abnormal. Exactly what Jamie touched up on as far as like pain. It shouldn't be super painful, maybe like one ibuprofen or two during your whole entire cycle, not like two daily or two every 4 hours. If you're having to call into work, or like unable to play in your basketball game, whatever the case may be, that's not normal. And so if you're experiencing any of those symptoms and you're like, wow, I actually didn't realize that's not how it's supposed to be, I would highly recommend going to see somebody like Jamie or your OB and kind of getting checked out by your primary care, even anybody, to kind of get some further testing, because that isn't normal. And then going back to, at least for like pelvic floor physical therapy, when should someone seek help? Anytime you're having any type of dysfunction as far as bowels, bladder, period, or sex goes, that is when you come to see somebody like me. So as far as like bowels, constipation or super painful bowel movements, or feeling like you can't control your bowel movements, you're having some accidents, that can be helped with pelvic floor physical therapy. Urinary symptoms, so like urinary leakage, maybe you cough or you sneeze or you can't hold for very long, you're going super frequently, you can come see me. We already kind of talked about like painful sex or painful orgasm, or any pelvic pain in general in that pelvic girdle area that I was talking about. Pain isn't normal. So if you're having it pretty constantly, I would highly recommend going to see someone. And sometimes all of those are related. So you might be like, wow, I have like 5 of those. And it might just be because of muscle tension that's causing all of those things. So yeah, and if not, we can definitely rule out that it's not muscular. And then maybe that's when you need to go checked up and see if it's GI related or something like that.
Awesome. Thank you so much. Let's see. The next one is, what non-hormonal approaches or lifestyle changes can positively impact fertility and pelvic health? I love that. I love natural things that we can do in our daily life. So I recommend a Mediterranean diet for people trying to get pregnant. It's also very good for your overall health and well-being. But feel free to Google a Mediterranean diet. Really, it's fish, green leafy vegetables, fruits, legumes, nuts, that sort of thing. And avoiding red meat is ideal. Abstaining from alcohol. I know in our society, alcohol's been touted as an okay thing, but it truly is a poison. It ages you prematurely. It probably has a negative impact on eggs. It's certainly not safe in pregnancy. So I would cut alcohol out. Of course, also abstain from other substance use, like marijuana use is not good for eggs or sperm. I encourage you to connect with your body and how you feel in your body with your current weight, because we certainly know that being a healthy weight reduces the risk of infertility, reduces the risk of things like miscarriage and other problems in pregnancy, like high blood pressure, diabetes, preeclampsia, C-section, things like that. So that would be a lifestyle modification I recommend. I think we should all be trying to get 10,000 steps a day. I have my little step tracker that's so good for our longevity and for our fertility and pelvic health. Weightlifting is so good for us as women. It increases our basal metabolic rate. The more muscle you have, the more calories you burn or rest. It helps us feel strong and healthy in our bodies. So weightlifting with heavy weights is what I recommend. Good hydration, absolutely being on a prenatal vitamin. Other things for women when we're older that would be helpful for fertility. So by older, I mean like 35 or older. I'd recommend CoQ10, which is an antioxidant supplement, 600 milligrams a day, may help with egg quality. And just common sense things trying to live a healthy life are my main natural things. You can also do well, what I recommend actually is ovulation tracking. So if you're trying to get pregnant, using an ovulation predictor kit, having a diary or an app that tracks your menstrual cycle interval, the time from when one period starts to when the next one starts, so you can predict your fertile window. Daily and every other day intercourse have the same chance of pregnancy, so choose what reduces your stress most. And really, when it comes to stress and fertility, I think stress is unavoidable in life. Stress is a part of life. It's where we can have a lot of growth. I think the important thing is to use this time to improve our stress management techniques instead of getting trapped in the sense that we can eradicate stress from our life, because we cannot. It's going to be present no matter what. But what we can do is improve on how we meet that stress and how we manage it. And so things like mental health therapists, meditation, journaling, walking outside in nature every day, learning something new is so good every day. And that's what I recommend.
Yeah, just to add to that, I like to talk a lot about breath. There's so much connection with the pelvic floor. And so just everyday things that you could do that can help pelvic floor is making sure that you are breathing. It sounds silly, but we tend to hold our breath, especially when we learn new things, or especially when we're doing something difficult, we tend to hold our breath. So just kind of checking in with that throughout the day. When you're getting in and out of bed, are you holding your breath and kind of like Frankenstein rising? That's putting a lot of pressure on your tummy, a lot of pressure on your pelvic floor. When you're lifting something heavy, are you holding your breath? Because once again, that's a lot of pressure going downward. So if you're looking for something just like every day that could be super simple is when you try to lift something heavy or you get up off of the couch, like exhale as you do it. Long story short, this gets like a little pelvic floor lift. It also gets a little bit of a contraction of the core. You think of you like blow candles, you can feel the core contract. So that's just something small that you can kind of focus on versus when you're doing repetitive lifting or repetitive getting out of bed over and over again and adding pressure to the pelvic floor and the abs that can weaken them or just cause more damage there. So that's just kind of an easy daily thing that you can add in addition to all the things that you listed.
Awesome. Thank you so much. So this one, I'd love your thoughts on this, Alyssa. Is there a too soon to see a pelvic floor physical therapist during the first trimester? That's a great question. So if this couple may be only a few weeks pregnant. So anatomically, it's good to know in the first trimester, our uterus, our growing uterus, is still very much protected by the bony pelvis. And so I know that, for example, massage, people may be afraid of massage in the first trimester, but it's actually quite safe because your uterus is truly protected in this bony pelvis. So what are your thoughts, Alyssa, about PT, pelvic floor PT in the first trimester?
Yeah, so I believe there is no such thing as too soon. We usually don't do like an internal pelvic assessment during the first trimester. Not that there is any type of like harm that happens during that, but there's just so much going on during the first trimester. It's more of like a protection for us. But pretty much that's the only thing that we don't do is like the internal treatment during first trimester, but second trimester we can. And once again, it's just a ton of educational things. And when you're only a few weeks pregnant, it's great to learn habits that are going to help you when you're, 35 weeks pregnant and having to like change your posture more. Now it's more important to focus on the breathing, getting in and out of bed. So we can kind of like start you off with learning habits before it's like crucial to know that habit, if that makes sense. So a lot of like preventative treatment and just education. Once again, just looking to see, just because you're not having any type of symptoms, we can look and check out the way you're moving and kind of see some things and be like, oh, I'm glad this isn't hurting you, but let's get after this before it starts to be a bigger issue. Hopefully that
Awesome.
answers your
Yeah,
question.
no, that's perfect. I agree with that. That's great. So the next question is, I have pelvic misalignment. Would chiropractic care be okay, or can pelvic floor PT be more beneficial? What are your thoughts, Alyssa?
Yeah, so I definitely think there's a place for both. I would say if you have been going to the chiropractor over and over and over again and it doesn't seem like it's getting better, maybe there is something that's pulling the pelvis out of alignment that is like not being addressed. So chiropractors are great at putting you back in alignment, but if they're not kind of finding out like why that's happening, then it might just continue to happen. We have so many muscles that are attaching to the pelvis, so what this person usually means is the pelvis can kind of get off balance and maybe like offset. It's not like dislocated or anything like that, but you can imagine if this is a little bit off, that's going to affect the muscle or the joint back here. It could also affect the pubic symphysis right here. But there's so many muscles. There's the pelvic floor here, there's the back, there's the core. there might just be tension or a way that you're compensating that's like pulling on one part of it and it's causing it to be out of alignment. Another thing is maybe you tend to, we all kind of favor a certain side, you know, maybe we hold our purse or our backpack on one side or our child on one side. We sit on one side of the couch. Doing that over and over and over again just kind of relaxes one side and contracts the other. So sometimes it's just a matter of paying attention to that. And you're like, oh my gosh, I always sit, you know, leaning like this. It's not so much that you have to sit like this all the time, but now maybe every other night lean on this side of the couch. And maybe that's what could be affecting the pelvic alignment. But I think there's a place for both for sure.
Yeah, I agree with that with both. And seeing what works for you, I think is important. And again, trusting yourself in that process. And I think it's also great to get established with someone with care. So some of these other questions are about when to get established. And I think it's important to, if you're having issues related to your pelvic floor and fertility, I would reach out to a provider, establish that connection so that you can work on preventative things to improve your future. And if something problematic happens along the way, you already have that connection and that relationship. You're an established patient, and so it's much quicker to get care versus being on a wait list to become a new patient. So the next question is, which kind of touches on this, if one is already pregnant and worried about pelvic floor dysfunction that could impact delivery and postpartum, what would be the optimal amount of time to do pelvic floor therapy prior to the due date, or could postpartum therapy be helpful enough? This is so great. So my feeling on this is that probably, late in your second trimester, if you're trying to just kind of get the biggest bang for your buck, so to speak, of your time. So kind of like around 28 weeks of pregnancy, if you're not having issues before then, would be ideal if you have concerns. So if you have predisposing risk factors, if you've had a previous pregnancy that you had these problems with delivery or postpartum, I'd actually get established even sooner. So like Alyssa said, I'd be working on that even before you got pregnant to go strong into pregnancy so that you can be strong during and afterward as well. I think that, life is hard too. And so I want you to give yourselves grace. I think that we all do our best. And so it would be great to get connected. But if your life is hectic and you just can't make it happen during pregnancy, that's okay. Give yourself grace for that. It's also okay to come when you're in trouble and you need help. And I know we'd both be happy to help you with that.
Yeah, I definitely agree with that. I always try to meet my patients where they're at. There's also so many different aspects that contribute to the frequency. There's insurance issues, there's financial, if you're not going through insurance, you're doing cash pay or commuting to the clinic. There's just so many things that go into it. I usually tell my patients, like, I'll meet you where you're at. Like, I would love to see you. If you're not having any symptoms, I have some patients that I'll see like every 3 weeks, and we're like checking in, like, okay, still okay. We want to keep for 3 weeks. And then as they hit the second trimester, doing more like every other week. And then we can always kind of adjust if they don't need it, but it's harder to try to fit you in if you do need it. Going back to kind of meeting you where you're at, there's also, we should be giving you homework and things to do at home so that, if you do live an hour away and it's really hard for you to get here and it just like increases stress, you're also maybe taking care of family members or just have other stuff going on. You're also doing fertility treatments. Then I don't want to increase stress and be like, you need to be here twice a week. Otherwise this isn't going to get better. There's plenty to work on your own. And if you are really consistent and, are honest with your PT too on like, okay, I have time for like I have 15 minutes. Like, what should I do? That's great. We'll give you information on like what you could do and like each day and all of that so that you can manage it at home as well. I know people hate the "it depends" answer, but it really does depend. I would always say, like, in a perfect world, I think like twice a week is always great, but obviously some people's insurances don't allow that, and a little bit is better than nothing. So also spreading it out is great. It's never too soon to come. And then a lot of places I know have wait lists too. So if you're worried about having pelvic floor issues, but they're not there, I would try to get a referral from your doctor, or if you're interested in cash pay, look for a cash pay clinic. And they likely have a wait list. So, just scheduling something, and it might be 5 weeks out. And then you'll have that assessment, and you can, if anything has popped up, then that's great. You can get it treated right then. And then if nothing has popped up, that's even better. And you can start to prevent something from happening.
Yeah. What I can sense from both of us, Alyssa, is that we both love education and love helping women. And so I think that it's really important to understand that even one visit with a provider that cares about you is incredibly meaningful. And we can learn things together that can empower you on your journey, even if you just come out one time. One of the other questions, I think the last question actually, is what are the recommendations for women with scoliosis and the impact on pelvic pain during pregnancy? And I have learned during this time with Alyssa that it's really, when you have scoliosis, I would recommend getting into PT before you're planning pregnancy, like just for your overall well-being and strength. What would you add to that, Alyssa?
Yeah, that's exactly what I was going to hit on. If you already know that you kind of have something that could be affected during pregnancy, especially if sometimes people have scoliosis, they don't have any pain or issues. But if you're having pain, would definitely try to get in beforehand. As far as the impact scoliosis could have on the pregnancy, is kind of a tough question, but pregnancy doesn't usually make things better. I don't know if that's a bad thing to say,
That's so
but
great. That's so great.
if you have back pain, it doesn't usually go away during pregnancy. So just things that we highly recommend are like belly bands, proper ones that can help relieve pressure, but think like weight is going to be gained, more weight is going to be moving forward, which is putting more pressure on the back. So it's just kind of trying to prevent anything prior to pregnancy is the best. If you were unable to go to PT beforehand, totally fine. Better late than never. And going to PT can be helpful in stretching muscles, strengthening the back, and doing it in a way where we're kind of manipulating the scoliosis to try to be in alignment. Kind of tough to explain, but there's different ways that we can move the body to try to strengthen in the proper alignment, even though I know that there is a curve. I don't know if that answered the question either.
That's perfect. Thank you so much. Any other questions for us today? We've so much enjoyed getting to talk to you today. I really appreciate your time and your attention. Any other questions before we conclude? I think that may be it. Alyssa, it's such a pleasure. This was our first time meeting virtually this way, and I've learned a lot from you. I really appreciate your time. And thank you to each and every one of you. I just want to leave you with a message of empowerment, an invitation to come home to yourself, to know that you are sovereign in your life, and this is your journey, this is your story. We'd love to help you on your journey.
Yeah, thank you so much for having me. And one thing that I just thought of, it's okay if you do end up waiting. And, sometimes I have patients that come in and they're 38 weeks pregnant and they're like, I know I'm late, but like, what should I do? And totally fine. There's so much education we can give. And like, there's people that want to help you. So even if you're like, oh, I'm too late, I'm already third trimester or whatever, it's never too late. It's never too early. All you can do is like what you can do. So, yeah, you're doing great.
It's so great. The last question was, they say, how do we get in touch with you for an appointment?
Oh, this is so nice. Okay. So I work at Rehab United, in the Kearney Mesa location. And so that's how you would get in touch with me personally. As far as like pelvic floor in general. Is this only open to like San Diego people? I don't know. Is this like,
No, I think, it's open to everybody.
Fine. Okay. Well, you can definitely I Google pelvic floor physical therapy, do a little bit of research on the therapists that are there and see kind of what they offer. And yeah, there's we're everywhere, but also kind of hard to find at the same time. So I totally understand. As far as me directly, like I said, Rehab United in Kearney Mesa is where I am at.
Yay. I feel so united with you in helping women. So everyone remember Rehab United. Because it is really important to find a provider who specializes in the pelvic floor when that is something that we want to focus on and improve and feel safe with and empowered with. And so if you are Googling, I want you to make sure you find a provider who specializes in that to give you the best care. Oh, and then the final question was for me, where am I at? So I'm at Reproductive Partners Fertility Center. You can find us on Google too. I'm here in La Jolla, right next to the UCSD building. And I'd absolutely love to help you on your fertility journey and help you through recurrent pregnancy loss too, if you ever have to face that struggle. It's been so wonderful spending time together. Thank you all so much. And I just hope you have a beautiful evening and go do some wellness practices to reconnect with your body, come home to yourself and feel safe and grounded and centered with your breath, connected to your pelvis. Perfect.
Thank you so much, Jamie.
Hi, thank you, Alyssa.